because we've combined the two forums that we usually have, although we don't have so many questions, but we do want to make sure we have enough time if people do type in questions as we go. Just as a reminder, I don't know that people need the reminder, we had originally scheduled this time to do a budget forum today. And as I believe people may be aware, the mayor's budget, which was expected to be out on Monday, will now be out this coming Monday. Our budget hearing has not changed. There are still 2 hearings scheduled. Both of them will be held remotely. The first hearing is on the 22nd, and that is for any stakeholders who wish to testify. All community people can log on to the council website to indicate your interest in testifying for the 22nd, and I think that's from 10 to 3. We'll confirm that before this call is over. And then on the 26th, we have the executive testimony. Keep in mind that the budget hearing that the council member will have on the 22nd is for DDS, Department of Human Services, and Child and Family Services. And it is scheduled for all day. I'm pretty certain that we actually are scheduled to go first on both of those days, so that if you sign up to testify, you may not have to wait all day to be able to do that. Our budget should be out on Monday, and so we will have a budget forum on Wednesday from 2 to 4. We have sent that information out for people. For people, I expect everyone knows this by now, but this week the mayor did announce that she was extending her stay-at-home order until June the 8th. So, unfortunately, the conditions are still not where they need to be in the district so that we could start to open things up. I do want to, as people may be aware, the mayor had established the Reopen DC Advisory Group, which is putting together a report for her to make recommendations about how to reopen. There were 12 committees in that advisory group. One of them was about equity and vulnerable populations. Well, I think, and many people expressed both to me and in the opportunities that were available online to express that to the mayor and to the advisory group, some concern about the lack of people with disabilities actually on that committee. We did have some focus groups last week, including a couple on Saturday, and so I want to thank the people that were able to participate in those focus groups, because all the information that was given to us then did get incorporated into the report that goes to the mayor. So, that people at least were able to have their voice heard in that forum. As we're talking about Reopen DC and looking at all the different aspects of how we reopen, we also need to be planning together about not just reopening, because I've been concerned sometimes when I hear from people, will we reopen on May 16th? Will we reopen on June 9th? We're not going to see something where one day a switch is turned on and we go back to where we were before COVID. Even when the stay-at-home order ends, the plans that are being developed now are about how we gradually move back to being fully open, but also how we do that in a way that ensures that everyone stays safe and healthy along the way. And what that means is that we are going to have some real conversations starting now about so for right now, we have a stay-at-home order. People are staying in. I think, no, I don't think, I know, because this isn't one thing. We have worked hard to make sure that people with disabilities have the same experiences as everyone else. And the reality is that everyone is stuck at home right now. Everyone is struggling with how do I spend my days. Everyone is going through the stress of that. So, you know, we're all having to learn this. And what we're going to have to learn going forward is what will days look like as we start to get to a place where we can reopen. The days, at least, you know, until we have, I'd say, a vaccine and treatment, the days of people going to a day setting with a big group of people, one, traveling there in a van with a number of people, and two, getting there and being in a room with a whole bunch of people who are not able to maintain a social distance from each other, those days are in the past. And we have to start thinking now about what the days in the future look like. How do we start planning for, as we start to move into the community, what does it look like and how do we all do it safely? So I'll be sending something out very soon, engaging with folks so that we can pull together a group of people, including self-advocates, families, providers who are in the provider coalition and not in the provider coalition, staff at DDS, bring everyone together and really together start to look at what can this look like, what will it look like, so that we are working together to create this different future that we have to have, because how people spend their days is going to have to look different. And we all need to look at that together to figure out together how we can ensure that people spend their days in constructive ways safely and we ensure their health. I just want to correct for people. Public testimony is on Friday, the 22nd, from 9 a.m. until 3 p.m. And you can go to the council website to sign in to ask to testify. They are limiting the number of people who can testify, so you should go soon. Before I move on to questions, I do want to give people an update. DDS does have their data reported daily with the district's data regarding people who have been regarding people we support who have been affected by COVID-19. And this morning, we reported 161 people who have tested positive, and this includes 23 people who we've lost to COVID-19. It also includes 38 people who we have listed as recovered. You know, we continue to learn. The CDC provides guidance about what defines recovered. Our standard for recovered is a little higher than the CDC's. We follow people longer than what they recommend because we do want to make sure that people have in fact recovered. One of the biggest issues, we have a lot of folks, I don't need to say this, a lot of folks who do have some underlying health conditions, and what is essential is that people are making sure to monitor all their underlying health conditions, because when COVID-19 comes along, not only are they more vulnerable to that, but then those underlying health conditions also create additional problems. So it's essential that people be maintaining that contact with their regular primary care physician, even though we can't, in most cases, get in to see our doctor right now. We can do telehealth, we can communicate with our doctor. The most important thing for people who have chronic health conditions is to maintain that regular relationship with their doctor. So I want to, in addition to just providing the data that's provided on the mayor's website, I also want to provide some context of that 161 people. Currently, 18 of them are in the hospital. 80, which is just about half of the people who have tested positive for COVID-19, have never required inpatient care for the treatment of their COVID-19. 40 people who did require inpatient care have been released and are back home. In addition to the people who have COVID-19, DDS also tracks all people we support who have had a close contact with a person who was diagnosed with COVID-19. So to date, that's been 266 people of the people we support have had contact with someone with COVID-19. Of those 266, 83 are included in the people who ultimately tested positive, and we're currently monitoring 29 of those 266. 154 of them we monitored for the period of time recommended, and those people did not develop COVID-19. Lastly, and just as important, provider staff who we're tracking, providers are giving us the information about their staff. To date, there have been 199 staff who have tested positive for COVID-19. 50 of those people have recovered and are back at work. 13 will not be returning to work. Included in those 13, sadly, is 5 who we have lost to COVID-19. And there are 136 who are still currently quarantined because of COVID-19. So that's sort of all the data. And we now had, as I said, just a couple of questions from people.
Okay, good afternoon, everyone. Are the staff and the people you support wearing gloves and masks when they're out and about? Are the staff and the people you support informed to constantly wash their hands?
So first of all, people should be aware of what you're required to do. And wearing a mask when you are out and about is very, very important. You know, as they have been repeating a lot, it is partly about the fact that many of us could have this and not even know that we have it, so it prevents us from giving it to other people. If you're going to a grocery store, you're required to wear a mask. There's a lot of places now that won't let you in without a mask, but even if you're going out for a walk in the community, because you may walk past other people or come close to other people, it is very important to always have a face covering on. There is not the same requirement regarding wearing gloves. I see a lot of people wearing gloves. There are circumstances where gloves are a necessary component when you're about to engage in an activity and touch someone, but gloves are not something that are always required when someone is going out. The other couple of really important things to remember, and this is why the gloves thing is not important, is wash your hands regularly and do your best not to touch your face, but certainly do not touch your face unless you've just washed your hands. So if there's a really bad itch on your face, wash your hands for 20 seconds, and after that, you can scratch. And only then, because you should be very careful. We touch so many things with our hands, so it's essential that regularly throughout the day we're washing our hands, preferably, if it's available, because you're home, with soap and water. Antibacterial soap is the best thing to use to wash your hands. If you're out driving and you don't have that, then you would use hand sanitizer. I think there's people who think when they hear sanitizer that must be cleaner than soap. The best thing to wash your hands with is soap and water, 20 seconds. For people that haven't heard this yet, you sing happy birthday to me 2 times, and when you're done, then you can rinse your hands off. And then always remember to stay at least 6 feet away from people, which means you hold your arms out, they hold their arms out, and you don't touch. Very early on, people talked about an elbow bump instead of a handshake. We quickly moved past that. We can't even get close enough for an elbow bump. Just wave from across the room.
It is very important that hygiene is monitored. Is the facial hair on men cut to keep out viruses and germs?
I have not heard that there's any need to trim your beard or cut your beard off. If we were on the video, you'd see I have a goatee, but there's not much there to hold much virus in it. I have not heard a concern about facial hair. in part because it seems like the biggest concern is that you would get your own virus in your beard, and so then it's a matter of people not coming in contact with your face. So I have not heard, and if anyone knows anything different, you know, that people should be clean shaven now because of COVID-19, please let me know, but I have not heard that that's a concern. The only thing, and I'll just go ahead and repeat it, wash your hands regularly.
Are virtual doctor's appointments being kept, and are staff continuing to make appointments?
Absolutely, and yes, they should be. And as I said before, one of the most important things that people should be focused on, you know, people who have some underlying health conditions, people over age 65, and those with underlying respiratory, which means breathing issues, heart issues, or diabetes, are especially at risk for COVID-19. It's essential that those people, and all of us truly, people with high blood pressure, for example, are taking good care of any chronic health conditions we have, which means staying in touch with your doctor. People should be either maintaining their doctor's appointment through telehealth or calling their doctor to see if the doctor thinks that rescheduling is okay. But people should be maintaining. It's so important. One of the things that really registered for me when we had the reopen DC, and the representative from DC Health repeatedly talked about the importance of everyone having a medical home. In the district, we are very lucky. We have one of the highest rates of people being insured, people having health insurance in the country, but we don't do so well when it comes to people actually being connected to a primary care physician. Within DDA, we do an excellent job with that. But it's essential then that people maintain that contact and stay on top of their health.
Are the homes and apartments where DDS people live, is it disinfected and sanitized? Is this enforced?
Yes, it is. And perhaps I can also ask Kirk if he can speak to, currently we have quality resource specialists who are checking in at least weekly with all of our providers, and they are taking some steps to actually monitor, to monitor the conditions in the different placements. And I'm going to ask Kirk to speak to that.
Yeah, Director Reese, you're absolutely correct. Our QR staff are making frequent contacts with the provider community to make sure that they are enforcing the Mayor's Order 063 that was released a few weeks ago, as well as emergency policy and transmittal that we issued to all providers. So we have passed all the information on, and we do frequently contact them to make sure that they are following all those protocols that were put into place.
Including, I've heard sometimes using
virtual meetings.
You know, looking over the telephone saying, show me that.
Right.
So they're not just calling and saying, tell me it's true. They are asking for documentation.
Yes.
And last question that was submitted, what activities are in place for all?
I mean, I think that's a really good question, and it's actually one of the things we've asked people to do is submit suggestions, because I think, as I said, this is something that many people struggle with, which is, what do I do now? You know, and you hear people sharing things like different shows you could watch on Netflix. I don't want to advertise for any particular provider, but, you know, different shows you might want to watch, different activities that you could do. We are limited. Things are not open. And so it's essential that within everyone's home, there be conversations about what kinds of things do we enjoy doing? How can we be able to continue doing those things? You know, it's a great time for people to sort of practice on or learn better skills on cooking. You can go on the internet and get lessons on that. You can, one of the things I wanted to make sure we mentioned today, starting this week, I believe it is, that people who use SNAP, which is food stamps, now have access to ordering food online to be delivered to their home. So, you know, you can go online, look up recipes, order the food, practice cooking. There are other, you know, now that we seem to be clearly out of any threat of a frost, people can start gardening if you have a yard. It's really requiring a lot of us to be creative about things that we can do safely, perhaps with other people, but always just at a distance.
And we received some suggestions or ideas for best practices, so thank you all for submitting these strategies. Some suggestions were to draw or write, listen to music, sing to music, listen to movies or watch movies. Also to maintain social distancing with one another, as well as being kind to one another, encouraging one another, FaceTime with important people who you're concerned about to keep one another encouraged, continuing to wash your hands, and that's it. So if you would continue to forward any suggestions, ideas for activities, ways that you're coping during this time. All right, our next question. Please provide a breakdown of the COVID data by residence type.
So to date, we have had 72 people in supported living, 55 people who were in intermediate care facilities or ICFs, 23 people who were in residential habilitation, 8 people who were in their own home, 2 people who were in a host home, and 1 person who was in a nursing home.
How many of the 199 staff who tested positive work for multiple providers?
1.
During the May 1st call, DDS reported that there were 47 placements under what DDS would consider quarantine. What is the number now?
64. And let me define that for you, because I know that some of our providers have also changed their staffing patterns, and they have placements where there's no one in the home who is positive or even had a contact, and yet they've changed their staffing pattern in order to reduce the number of staff who have contact with people. I would not consider those in quarantine. When I look at places in quarantine, I'm looking at any of the homes where there's a person who's had a contact or a person who has tested positive, and there are 64 of those places.
Are the people that providers are working with giving them staff the virus? Is it their fault? Do they know that this is not their fault?
So I'm not entirely clear about the question, but so, you know, there are people we have who we know, for example, some people who live in an ICF who have not been out of their home since the stay-at-home order started, and the only way that they could have gotten the virus would have been from the people who came into the home. So it is likely, and this is something I talked about before, any one of us, unless we've been tested and know that we tested negative today, and all that we know if we test negative today is that today we don't have it, any one of us may be walking around right now with the virus and not know it. And so in those circumstances, I heard Dr. Fauci describe this as a very efficient virus. It's highly transmissible. It seems to be very easy to get this virus, and that is why it is essential that we are hyper vigilant, that we are very careful about sticking to what are considered universal precautions, making sure that we're regularly washing our hands, not touching our faces, and keeping our distance from people. So, you know, everyone, it is a virus. It means that if you have it, you got it from someone. But is there any, I think the word fault or something was in that question. No, I mean, people aren't giving it to other people knowingly. People may have it and not know it, which is why it's really important for each of us to be very careful in how we conduct ourselves. Someone did say that men have been advised to trim their facial hair because it makes sure that their mask stays tight to their face. Okay.
When can we go back to work?
Well, it depends. I'm at work today. So it really depends on the kind of work you do. And, you know, some people work in, like, for example, when we had our focus group on Saturday, one of the people had to leave because they were going to work. Because that person happens to work in a grocery store and is able to continue working and doesn't have the concerns that some people have, which are like, you know, people who are over 65 or have underlying health issues may decide that it's not safe for me to go back now, even using precautions. So part of it is the place where you work open yet? So it depends on where you work. DC public libraries, I expect, will open up slowly, just like the rest of the district government will. And so, you know, they're not open yet if someone works there. It really depends on where you work, when they will be opening, and when it is safe for you to be going back to work. And I really encourage people to have those conversations, you know, with folks who support you about when is it safe. Maybe even it's a question in some instances for your doctor. Am I a person who's at higher risk? Is it safe for me to go to work if this is the kind of work I do? Those are all really individual questions. I will tell you, just as an example, RSA has placed in new jobs over 90 people since the stay-at-home order started. So not only are some people going to work, but some people are also out getting jobs. But like I say, please make sure that you talk to people close to you, that you get medical advice about whether going to work for you is a safe thing to do.
When is testing of asymptomatic DSPs going to start?
It has started already. So DSPs can be tested already. They can be tested at, if they have had a contact, they can be tested at any of the public sites. Some of our provider agencies have already started testing their DSPs. I don't believe DC Health is here with us today. I think they would always, at this point, include the caveat, testing negative today is a snapshot of today, and that's all. And it is essential, even if a person tests negative today, they still have to continue using all the same precautions that everyone else uses. Even if I have a test today that tells me I'm negative, I should still act as though I'm positive and that the people around me are. I should wash my hands regularly, I should wear face covering, I should not touch my face, and I should keep social distance. Testing is available, but it should not change anyone's behavior, except that if someone tests positive, clearly they are not going to be allowed to go to work.
Have the protocols around accessing technology in the waiver been revised so that people can more easily access the purchase of technology without the requirement of assessments or other cumbersome requirements that slow the process. Can providers get information on this? What is the current utilization of technology under the waiver? How can we help?
So we didn't include in our Appendix K any change to how we purchase technology, which we are looking at in our amendment that takes effect in October, which is a good point. So, you know, we have said people can use more technology, but there is still the challenge of purchasing the technology. So we aren't currently measuring utilization because of the way that it was written into our waiver, which is very unfortunate because it's made it more difficult for us to make the changes we want to make because we have to prove to CMS issues about the current utilization level. It's too late to say this, but it would have been really helpful to say some of these things like 2 weeks ago. But because the two of the things that you're raising would have been very helpful to have included in our Appendix K to make sure that the access to the equipment, because we did include, you know, the ability to use it. Yeah. And we've been looking at this problem that you're identifying here so that when we do our waiver renewal in October, it would be fixed. Mm-hmm. But we seem not to have connected those two dots. But let us look into whether there's anything that can be done about that, and we'll hopefully talk further soon.
Can you please explain the rationale behind recommending vitamin D for immunity boosting for the ID population? The research reference was done on animals, and the clinical trial is currently taking place on humans. This has not been a recommendation from the CDC for all persons to take vitamin D. What evidence-based research on humans are you using to make such a recommendation?
Just to be clear, there was a recommendation, and the recommendation was talk to your primary care physician. For people who are not aware, which I was educated about, in my own family, African Americans have a higher rate of vitamin D deficiency, which has issues related to immunity, and it's a very important issue that people need to make sure they're addressing. The guidance that was sent out recommended that all of our providers should just check in with a person's primary care physician. There is not yet any recommendation that says that this is going to do something for COVID-19. But what there is that the CDC or NIH, there's an NIH-sponsored study that is looking into whether it could benefit. So the idea was, if they're looking into it, at the very least, talk to your physician, see if you've had your vitamin D checked, and confirm with your physician whether they believe it would be a good thing for you. As I said before, the most important thing is that people are monitoring their underlying health. Part of monitoring your underlying health is checking vitamin D regularly, making sure there's not a deficiency, and checking in with your doctor about that.
Is there a status concerning the Appendix K update?
As soon as there is, we will give it to you.
Are there any other questions?
So I don't see any other questions, but we'll sit here for a couple of minutes. And if people have questions, please type them in. Emily. So Emily has included,
We're going to share a link.
so, sorry, I didn't notice. We're going to share a link with you on DDS's website of COVID things that people can do in the community. So it's a list of things some suggestions for people about things to do. So for people that have access to the website, you can go to the dds.dc.gov and look under Community Integration Resources.
Fatalities by provider type.
Are there plans in place of how IDS will look post-COVID?
Well, this is exactly the kind of thing that we need to be talking about. So when I was talking about, we're not going to flip a switch and go back to pre-COVID, IDS as well was all about people engaging in the community. So making sure that people can do that safely as well is going to be important. So we'll be talking about all of that.
Is it a requirement that each residential site be taking the temperature of staff daily?
Yes, this was part of the mayor's order. Before people come to work each day, they're required to have their temperature taken. And our quality resource specialists are asking to see the logs of the evidence that this is actually occurring.
Can you give a breakdown of COVID fatalities by provider type?
Yes. So of 23 people who have died, 11 have been in intermediate care facilities, ICFs. 7 have been in supported living. 2 have been in a rehab. 2 were in their own home. 1 was in a host home.
Is DC paying for childcare for essential employees like Maryland does? Are there any childcare resources available for RSA clients who are looking to go back to work?
I'm not aware of the district paying for childcare for people. I am aware of reserving childcare spaces for some employees who are required to work and have to use childcare. You know, what had occurred in Maryland is that in order to access childcare, people had to show that they were an essential employee. Otherwise, they could not access childcare. Maryland, from my understanding, was not paying for that childcare. They were only allowing people to have their child at a Maryland licensed childcare facility if the person had evidence that they were an essential employee. So I know that we had to provide documentation. We didn't, but the different district agencies where people had to use childcare had to provide documentation that they were essential employees so that they could access childcare. My understanding of it wasn't that they were paying for it. Well, I'm not aware of DC paying for this for employees.
For those people on the phone, if you have any questions, you can text 202-590-7618. Again, that's 202-590-7618.
Can the stats be sent out in the summary of the session?
So like all of our sessions, this is being recorded and a transcript of the session will be provided, so all the stats will be in that transcript.
Again, that number to send a text message is 202-590-7618.
You stated that DC is not paying for child care of essential employees. Is it DDS's position then that DC RSA will not cover child care costs for any RSA client?
No. So there's no change regarding provision of child care as part of an RSA case from prior to COVID. So that would also be an individual thing you would need to talk with your VR counselor about. Child care is a service that can be provided through RSA. If someone gets a job, however, RSA doesn't provide ongoing supports to people once they're working. So it's not going to be provided in that way. But child care is a service that's available through RSA, and you would need to talk with your VR counselor if you need that service so they can talk about how they make the determination about whether that's a service that's necessary to help you maintain your job or obtain or maintain a job, and how they can help you to get that.
How do we maintain employee health privacy and maintain log of temperatures?
So if any provider has any concerns about privacy issues when it comes to temperatures, they can definitely reach out to their QRS or contact me directly, and we can figure out a way around. But there is, concerns around health privacy. We can figure out a way to kind of shield that information, but As far as I know, and I referred back to Director Reese as well, I'm not sure the specific concerns around health privacy or health information privacy that raises when it comes to temperatures. I think we would definitely want to know if someone is running a temperature and has been admitted to the home. So, I implore you to reach out to your QRS supervisor, or me directly, and we can definitely have a conversation about that. And this was Kirk Dawson, by the way.
How are people notified of the arrival of stimulus checks?
So can you elaborate? Is that the arrival of stimulus checks?
I assume that you're referring to people for whom we are the representative payee. And so we don't have the person from operations with us who I could look to and say, can you answer that question, please? Yeah, that's correct. So we'll have to give you the answer later. The district receives that money, and then the money is paid over to the person, and so we need to make sure that we're notifying people of that. And so next week on our call, we will have a summary of what our process is for managing those stimulus funds in the cases where DC is the rep payee. On our next call, next week, we will all be listening to the budget hearing. So 2 weeks from now on our call, we'll provide the information about what the process is for processing those stimulus funds.
Once DDS begins discussions of reopening day programs, will all day program providers have an opportunity to participate, or will DDS have specific agencies as part of a focus group?
Well, we'll start certainly with a focus group, and then we'll share from there. We're not going to try and have a conversation with 80 providers at once, but we will do the best that we can about making sure that we're sharing the information that we're hearing from people and the direction we see ourselves headed. But we will try to identify, as I said before, providers who are in the provider coalition, outside the provider coalition, providers who do facility-based day, community-based day, individual-based day, so that we have a good mix of everything, so that we are hearing everyone's views. For people that are in the provider coalition, that's one opportunity for you to sort of join your voices together, so we can expect that through that small group of, or that group of providers, we at least hear all their voices, and we will do our best to hear from everyone, so that what we create is programming as we move through this that really ensures that we're accomplishing the goals of those day services while also ensuring the health and safety of the people who receive them. So I'm not sure why privately, but someone did provide a couple of suggestions, and I want to just repeat those suggestions for people in terms of activities that people can be engaged in while you're at home. And there are two really important activities that all of us, at least all of us who live in DC, I hope, are engaging in. First, it's been quite some time now since we received a card in the mail that gave us instructions about how to do the census online. And we should be ensuring that every single household where people we support live have completed their census forms. And second, elections are June the 2nd, both in DC and in Maryland, and we are all able to vote by mail, and you should be looking into how you can vote by mail, requesting your ballot, and voting. It's a private decision, but it's something that the House can work together on to make sure that everyone who lives in the home has a ballot if they want one, or if they still need to register, there is still time. They register to vote and express their views on Election Day, which in DC is, and Maryland, is June 2nd.
A question came in via text on how are you monitoring people, or how should people be monitored going in and out of host homes?
So the mayor's order that came out that put restrictions on staff in DDS placements was putting the restriction on people in supported living, residential habilitation, and ICF. The mayor did not make an attempt to dictate to people about their own home how they would allow people in. So that order doesn't go to host homes, and it doesn't go to services in people's natural homes, of course. But for host homes, we've provided the same education to those providers. They should be taking all the same precautions, but the decisions that they make about allowing people into their home are their decisions.
I heard that the convention center is used for COVID-19 treatment. Is it functioning now? What kind of people could go there for treatment, and does it have a test center too?
So if you're interested in learning about locations in DC where you can get tested, and there are several, you should go to coronavirus.dc.gov and look at testing, and you will see all the locations where there's public testing available in DC. The convention center is now ready, and it's ready to serve as what's called surge capacity for the hospitals, so that if the hospitals get to a point that they no longer have capacity to provide care, the convention center has additional capacity. To date, fortunately, and hopefully throughout this public health emergency, we have not needed it. Hopefully we will not need it, but it is there as a backup should we require additional capacity beyond what is available in the hospitals.
Can you speak to any efforts in coordination by DDS to assist providers in sourcing PPE and scanning thermometers rather than everyone searching all over the DMV and beyond?
So in terms of PPE, what we have reminded providers, I think pretty frequently, is that the Health Emergency Response and Preparedness Administration in DC Health is the source of assistance for PPE. They have had communication, I believe, with all of our providers. They ask the provider for to know what their current inventory is, so that they can make the PPE available to ensure that as it's needed, it is available. They continue to work with folks. Today is the first time DC Health has not been on the phone with us, but they have always been on the phone each week. We changed this time several times this week, so they're not here today, but they have been with us each week. They've been a very strong partner of ours, and I believe that they've been a good partner to many of our provider agencies.
For people that are permanent residents and don't have insurance, how would they be treated, and what happens when they couldn't afford to pay for their medical expenses?
So that is a question beyond DDS. I don't think that we have DHCF on the line today either. I do know that we have the Alliance in DC for people who are not eligible for Medicaid. But I also know that anyone who receives services through DDA does have all of their health needs met. Beyond that, it would be a question for DHCF if there are people who have medical needs beyond what's covered by the DC public health system. But as I say, in DC, we have both Medicaid and the Alliance for people who are not eligible for federal Medicaid. But I'm not an expert on the health insurance options for people in the district.
All right, someone shared some suggestions for things to do. So an online masterclass series, which they can do at their own pace for those capable using online gaming systems to play with their friends. Examples are platforms such as Facebook, Jackbox, etc., trivia, bingo, and I know I've been playing Monopoly with friends. So there are some ideas.
A question came in via text. In accordance with CDC recommendations and avoidance of touching face, mouth, and nose, how do we, as providers, deal with participants with severe intellectual disabilities that constantly engage in these activities?
So there's a couple of things. The caution about not touching your face is when your hands are not clean and after you've touched something else. So for one, limiting what kinds of things they can touch in terms of, you know, if you're supporting someone, making sure that you're not touching surfaces that they then touch, but also regular hand washing. You know, either using, if you can, if you're in the home, clearly soap and water is ideal. If that's not possible, using hand sanitizer. You know, that touch could even, you know, it's very individually based. That touch may be very soothing for some people. But making sure that their hands are kept clean so that as they are touching their face, they're not coming into they're not picking things up off of a hard surface and touching them to their face. But you're able to, you know, have them regularly wash their hands just like all the rest of us do. We all regularly touch our faces. I challenge anyone to document themselves going through a full day without having touched their face. And so it's something that we all need to be aware of. And the people that we support in some instances might need more support in making sure they're regularly washing their hands. I see that we're at the end of the hour. Once again, I know we have a number of providers on the line. I don't know how many provider staff are on the line. I really hope that the providers are communicating to their staff how much we appreciate the work that they're doing. What we've seen throughout this has been, all of us have been learning as we go. Providers and their staff have been changing how they do things to try and stay ahead of this, to try and ensure the safety of the people that they support, while in some instances, as we've seen, 199 provider staff who have come down with COVID-19, we really appreciate, we recognize that you are on the front lines in this battle with us to ensure, to do the best that we can, all of us together, to ensure the safety and the health of the people that we're supposed to support. So please communicate that from us. And as many people as possible, please sign up to testify in our budget hearing next week to talk about the importance of the budget for the DDS. We will talk with you Wednesday about what is included in our 21 budget, and we'll have our next forums. There will be a community forum and a provider forum in 2 weeks. Thank you very much.